Hi everyone, it's me, Krylios, Team Rayceen Productions MC and producer. And joining me as usual is the legendary Rayceen Pendarvis.
Greetings and salutations all.
Yes, lovely to have you here, Rayceen. And joining us, of course, is Nikilas Mawanda from AHF Pharmacy, which we love. They're a wonderful supporter of the Ask Rayceen show and Team Rayceen Productions. So we're so happy to have Nikilas here to chat with us. Hey, Nikilas.
Hello, thank you for having me.
We're so
Our
honored to have you today.
pleasure.
And we are so honored that AIDS Healthcare Foundation is one of our proud sponsors for the 2020 season and believes in our vision of uplifting and motivating our community, just like all the wonderful things that your agency does.
Definitely, definitely. Now, let's talk a little bit about AHF Pharmacy. And for the viewers out there that don't know what AHF is, give us a little bit of background about AHF.
So AHF, we are in full the AIDS Healthcare Foundation. We were founded in California in the 1980s. 1987 was the year when the pandemic was at its peak. We came in to definitely mitigate and take care of our friends, our family who were dying at that point. AHF has so many branches. Pharmacy is one of them. We have another branch that does medical care. We have clinics, and we also have part of the clinics. We also have the wellness, which does the testing. We also have a housing branch. We also have a research branch. We have an advocacy branch. So we are big. We are the largest HIV provider in the world. In the United States, we are more than 20 states. And globally, we are over 46 countries. So we love what we do. We do it for the community, but this is who we are. Regardless of ability to pay, we'll give a service.
So tell us a little bit about you. How did you come to be a part of the AHF family?
That is a very, very interesting question, and I love the question. I'm originally from Uganda. In Uganda, I was an activist. And when I came to the United States in 2014, I got acquainted with different people within the LGBT community. And one of my friends is one of our regional directors. So I got to know about AHF through a friend working with AHF. And they were telling me about this wonderful organization, and they wanted me to maybe, look and see if I'll be interested in joining, because they knew my kind of work. I am this kind of person. I do a lot of advocacy. I like doing advocacy, but in general, I just want to be a service. That is my calling. That is who I am. I want to help. So at that time when they told me about AHF, I was working somewhere else, but I kept on coming back to that. And when the time was right, I was like, oh, okay. And there was an opening, and I applied, went through the interviews like everyone else, and they chose me as a candidate. And since then, I've been working with the organization for over a year now. I love what I do. Like I say, help is my DNA. That's it. I just want to help. I want to find solutions. I want to be of help in any way that I can. And I get the opportunity to meet people from the community. I meet many people who are going through different things in life. And I just want to be part of their journeys as a puzzle, to see that they win, to see that they're successful in life. For me, anything that changes someone's life situation, it's a win for me. I feel comfortable.
I love that. I love that. And you speak about helping and assisting as well as community building. And that's one of the things that AHF is, very much known for. Now, tell me about, your collaborations and partnerships and sponsorships and, supporting of, local and, national LGBTQ organizations, and not just LGBTQ organizations, but other organizations and community development places altogether. Tell me about that and the reach that AHF has.
I'll say that it gives me so much comfort to know that I'm part of an organization that cares so much about the community, that is part of a community that does not only give a service, but also want to make sure that everyone within our community gets something. Now, I am blessed to be part of the office that does so much of community collaborations or community partnerships within the DMV. And I can tell you that the time that I've been with, we've done so much. We've sponsored so many organizations. It doesn't matter how big or small you are. Globally, as we speak, we are in the middle of a pandemic. AHF has given out millions, over 2 million we've given out globally to look out for our community, provide foods, meals, because we know that people are not at work. Here in the US, millions have been out of work. Millions are scared to come out because they're scared to get infected. And we are trying our best. The pharmacy is doing even door deliveries to make sure that people don't go without their medication. We literally came up with a grant that is helping people who have run out of insurance and can't pay for their medication. So we're taking care of that. I mean, we are doing as much as we can. We know it's not everything, but we are doing as much as we can. And I can tell you that many people, I see smiles, I see them hopeful. I see them because we know that our services are also life-saving services in some cases. So we are trying, and I'm proud to be part of this team.
And that's important. I think what people who have no clue or understanding of what AIDS Healthcare Foundation does, I think it's so important because once a person comes into any of your organizations, any of your buildings, any of the moment that they are diagnosed, you take them through all of the complete wraparound services. And it's so important that folks know that they can have a place that the moment you walk through the doors, you have a clinical person who will take care of your clinical needs. You have someone who will address your mental health needs, someone who will address the fact that you may not have insurance or how to connect you to get insured. Mm-hmm. And then there is right there a facility on site that you can pick up your meds right there on site. And if you're unable, and once you get into the system, the fact that you can have it sent to you is even more helping, especially during this time, that yes. All of those services. And folks it's so important that folks that know that what AIDS Healthcare Foundation does, especially now, that how you can connect them to their mental health providers via Zoom.
Yes.
And they can have that experience or they can call in and they don't feel like, oh my God, because I'm in the middle of a pandemic, how do I address the issues that I'm already dealing with mentally?
Yeah.
And then compound by the the pandemic, and it's so important that they have all of those things right there. And you guys you have your pulse
of course. On the community. I love that. And, actually, Nikilas, tell me about how you guys have had to adapt, with this pandemic, in place. Tell me how you guys have had to adapt to the changes.
I think that if you would ask anyone, nobody was prepared for this. Anywhere in the world, nobody was prepared for this. But like you said, we are adapting to this. Many of our patients are also learning to adapt to the situation. Some of them are actually having telehealth appointments because we want to be, we want to make sure that they're also safe, but also we want to make sure that our staff is also safe. So, and now most of people are having telehealth appointments. Some of them are able to come in. Those who are coming in and they don't have masks, we have masks right away. They go through most of these things they can do on their phone. We have a system that is letting them pretty much look at their everything on the phone. You don't need to be very, computer savvy or anything. And it's in different languages, Spanish, French. So they're able to at least look into whatever their charts are, and they know, okay, so I'm due for my labs, or I'm due, and they can also communicate to their doctor. They can send messages to their doctor. They can for medication through just using their phone, using the phone. So that system is really come in handy, and we have had it for a few months now. We've also upped up even with case management. Case management is also doing the same thing. They can have those appointments, or via phone, and make sure that someone is taken care of and they're connected and the referrals are made so that people don't necessarily have to make a trip to come to the clinic unless it's really necessary. And that's why I say, even with medication, we can ship it wherever they are. However, if it's urgent, we have a courier guy who will drive to their door and drop it at the door.
Oh,
So we are doing as much, yes. We're doing as much as we can. And like I said, if someone's insurance runs out, we don't want them to have a stop. No, we would make sure there's a continuum of that. But in the meantime, they are working with our benefits counselor to make sure that there is coverage. So,
And that's important. That's so important that folks know that. And you guys are, I think it's tremendous, and especially in the times that we are living in, and how your agency has just adapted. Just come in at full force, where so many people are overwhelmed with everything that they're dealing with. And the fact that, one, when they know that their health needs are being met, that's so important, that they have an agency and they have folks inside the agencies who care enough about their healthy, their health, their well-being, their mental, their everything. And when folks feel that, they know that AIDS Healthcare Foundation is just more than just an organization. It's like walking in and sitting down with your family and having the needs addressed by a family member who makes you feel so comfortable and welcoming and affirming. And it's a place that just affirms their soul. And that's so wonderful.
very, very wonderful. And you know what's even more wonderful? The fact that AHF has sponsored us. Listen, we have also have to adapt to this time. And so we've been doing a lot of online content, a lot of virtual content, and we just thank AHF so much for being our production sponsor. So when our viewers watch our YouTube videos, they see the AHF logo at the end of every video, because you guys are our production sponsors, and we thank you guys so much. You're doing so much in the community for people's health, for people's physical health, for people's mental health, as well as sponsoring those community organizations and teams and companies and all of that that are trying to make a change within the community and trying to do good. So we thank you guys at AHF so much for all the work that you do in our community. Thank you guys so much.
Thank you as well. Thank you.
Nikilas, how can people keep up with AHF, social media, the website, everything? Tell us about that.
So people can go to www.hivcare.org, and they can also go to www.stdtest.org, or they can go to www.aidshealth.org. They can also, call us directly on our numbers, 202-329-7189. And also they will find emails right by the website. Reach out and we'll be glad to assist them at any point. The number that I've just given is on 24/7. They can even text, leave a text message. I'm happy also to answer any questions if someone wants to reach me directly. My email is nikilas.mawanda@ahf.org, and that is NIKILAS.MAWANDA@ahf.org.
Thank you so much, Nikilas, and thank you so much for joining us. It's been such a pleasure having you here.
Thank you guys, I appreciate it.
Beautiful.
We appreciate you. And most of all, to the viewers, thank you for watching.